Hello and welcome to the NRTRC's monthly webinar. I'm Bob Wolverton, Director of the NRTRC, and I'm glad to see such a large crowd here viewing our presentation today. Before we get started, I'd like to apprise you of our next webinar coming up, which is a discussion of telepresenter training with Shireen Schlegel, who is at Swedish Seattle Health Systems, and she's going to talk about their training program for telepresenters. I think that'll be pretty interesting. At the end of the conference, Martha will put up a link, actually force onto your website, I should say, uh, the survey asking you your thoughts and ideas about this webinar and what you'd like to see coming up. I'll go through the modules on the board quickly just to let you know what you're looking at. In the Files module, down below the names on the right side, you'll see a Save the Date postcard download that talks about our upcoming conference in Portland, Oregon in March, and the presentation slides, a PDF of the PowerPoints that Jake is going to present for us. And then the links below will, NRTRC conference website will give you more information on the upcoming conference that we just talked about. An opportunity for you to sign up for our mailing list to get notices for upcoming presentations and interesting things that we find to send out. We promise we won't spam you, but we will send you good data. And then just in case something goes wrong, you can connect to the webinar survey through the link on the bottom there. To the left, you'll see a chat module, and we can use this for questions about how Adobe Connect is working. If you're having trouble connecting, Martha monitors that, and we'll get to work on fixing up any problems you might encounter. And then, excuse me, and then the question and answer module follows that, and that is a place for you to type questions that you might have for Jake as the presentation goes on. So, with no further ado, let me introduce our speaker for you today. Jake Yarbrough is a healthcare communicator, and he's been connecting organizations and information for more than 20 years. He's the Dallas Regional Partnership Development Office Leader, that's a long title, longer than mine, for the Agency for Healthcare Research and Quality, which is acronymed down to AHRQ, Regional Offices Project. In his contract role with AHRQ, Jake helps bring tools and resources for groups across the healthcare spectrum in his 14-state territory. While he's not a clinician, Jake has made several presentations to leading clinician and patient organizations in Arizona, Arkansas, California, Hawaii, Louisiana, Oklahoma, and Texas, just to share this program that he's going to be talking with us about today. Jake got his bachelor's degree in journalism from the Texas Christian University. And just an extra little side note, Jake stepped in at the last minute when our original presenter moved on to a different job position. So I want to thank Jake for jumping in and taking over on this. And with that, I'll say, Jake, take it away.
Thank you so much, Bob, and it is my pleasure to be here. Now, I know there's a lot of people who are interested in this topic, and I made careful notes to look for Ms. Schlegel's presentation on telepresenting. I'm sure I could pick up a few pointers for that next session. That looks very, very interesting. So, but thank you so much for having me. I am Jake Yarbrough, and I am officially a contractor. I work with an organization that specializes in healthcare communications, and we have been tapped by the Agency for Healthcare Research and Quality to help people understand the valuable tools that are available through this program. And if I were to leave you with one single message, I could summarize it in one word, and that is bridge. Our goal here is to bridge research with practice, and I'm going to share with you a little bit more about how this program attempts to do that and provide tools to both clinicians and patients in order to help them make their decisions about treatment options from the vantage point of as much information as possible. So I'll go through briefly what AHRQ is and more specifically what the Effective Healthcare Program is, It is a part of AHRQ, and it's based on this notion of comparative effectiveness research. We're going to talk a little bit about the partnership network that has been built around this program, and where we see some shared benefit between AHRQ and telehealth organizations like yours. The Agency for Healthcare Research and Quality is the lead agency within Health and Human Services that's charged with improving outcomes, lowering unnecessary cost, and ensuring broad access to care. It's a familiar refrain in healthcare these days, and AHRQ has been doing this for a long time. And AHRQ is one of many agencies under the umbrella of HHS at the federal level. And while some of the sister agencies use maybe a microscope or a magnifying glass for their vantage point, AHRQ tends to be a little bit more of a telescope. They look at the broad range, they look at large system-wide updates and changes in order to help facilitate long-term trajectory of healthcare change in the country. And its mission really is quite simple, and they do support this mission through a lot of research. About 80% of their budget goes to research and grants that are focused on improving care. And if I'm in a room with 100 people, I ask if anybody is familiar with AHRQ, and usually it's in the neighborhood of 10 people who raise their hand. And of those 10, the majority are familiar with AHRQ because of, I applied for, or I worked on an AHRQ grant. And so the AHRQ grant program is quite extensive, and that's often where people come into contact with the agency initially. But they do a lot of great research. And in 2005, when President Bush signed the Medicare reform bill, it was the Effective Healthcare Program itself was born. And the Effective Healthcare Program came about because there was a realization that while AHRQ provides a lot of great research, it is not the only source for information. In fact, there are a lot of organizations that do very good comparative effectiveness research. A pharmaceutical company, they conduct excellent research, great methodology, but often they will report just their drug compared to another. And so what was lacking was a single source of unbiased information that shared the entire spectrum of outcomes-based information, and in order to help patients and clinicians and even policymakers make decisions from a level playing field, if you will. This program does not and will not make any specific treatment recommendations. You're not going to see that in the Effective Healthcare Program. What you will see is a presentation of the benefits, the harms, where there are gaps in the knowledge for interventions for specific healthcare conditions. And again, long term, our goal is sort of that telescope view of improving healthcare quality and outcomes by having all of us focus on good quality, objective information and making decisions from a place of being informed. This program is built around comparative effectiveness research. Again, that looks at it's a type of patient-centered outcomes research, really, where it looks at any intervention into a healthcare condition. So whether that's a drug, a device, a diagnostic, a surgery, looking at all of the possible ways to address that particular condition and comparing effectiveness, risks, and adverse events and placing them in one place. And again, we often talk about the fact that we provide tools to people. We're not making the rules, but we're giving you the tools to make the most informed choices possible. There are 14 priority conditions that have been outlined for the Effective Healthcare Program, and these priorities actually were created when Medicare reform was signed. There was a period of public comment, and after that, the 14 conditions you see here on this screen are what came about. They're not listed in priority order, they're just alphabetically listed here, but we do tend to see, as I'm sure those of you in day-to-day practice see, things like diabetes, cancer, cardiovascular health, mental health. Those tend to be the real big conditions that people are very interested in. But there are again, beyond those 4 priorities, there are 10 more that are used to focus the research output for this program. So after an exhaustive methodology that is really stakeholder-driven and transparent, in fact, people in the public submit the questions to be studied. AHRQ looks at those questions. If they meet one of the 14 priority conditions, and they also there's some other things they look at, like the impact on Medicare, Medicaid, or direct or indirect cost to patients or society as a whole. If the question that is submitted by the public passes muster, if you will, it is then given to one of 15 evidence-based practice centers located around the country. And these evidence-based practice centers are world-class research institutions that are on an annual contract, audited regularly, and they take that question and do essentially a meta-analysis. They also look at that, they do a horizon scan to see what's coming down the pike, but they do a meta-analysis of all the sources of both domestic and international data in order to prepare their findings. And it's usually an 18-month process, because there are a couple of places where they put their findings back in front of the public for public comment and input. But after about 18 months, they develop a systematic review report. So, for example, the RAND Corporation in Southern California at UCLA does a study on type 2 oral medications for type 2 diabetes, and they publish this report that is 400 or 500 pages. It's the size of a phone book, and it is something that's extremely valuable for people to use, but not very practical for a layperson like me, or for those of you who are clinicians that you've got a lot of other demands on your time, and so it's not as practical to read through 400 pages to get the insights about treatment options. And so the Eisenberg Center in Houston at Baylor College of Medicine has the responsibility to take that phone book and distill it down into summaries that are easier for other audiences to use. And so on this slide, you'll see a gathering of all the different elements that come about. These are tangible tools that the Effective Healthcare Program produces. And if you have filed and paid your federal taxes in the last however long you've been filing and paying taxes, if you've paid your federal taxes, you have paid for these materials. So they are out there available for anybody to use. But the systematic review report, the phone book-sized report, is sort of here in the center, kind of the hub of this wheel, if you will. We have a number of pieces that are out there, and I'm going to go into a little bit more detail on these clinician summaries and the consumer summaries. But suffice it to say, excellent distillation of a lot of information. The Eisenberg Center and other groups actually produce fully accredited CE and CME modules that are available through this program. They're delivered online and on demand. So if you're a primary care physician, you can go and get credits attending one of these CME modules online. They handle certification. They do the pre and post tests, so it's a turnkey process. There are some great slide sets available for those in academic settings, kind of a faculty slide set that you can actually mix and match and pull together slides that would be most appropriate for your presentation, and it includes full speaker notes, but a really nice tool to gather information for a more academic setting. There are conferences and webcasts on a regular basis that AHRQ and Eisenberg Center produce. There's a couple of patient decision aids, one for prostate cancer, the other for osteoporosis, wherein a patient walks through an online version of a research summary, but goes through understanding the condition, the benefits and harms of all the treatments, where there are gaps in the knowledge, and then at the end of that process, if I've been diagnosed with prostate cancer, I can indicate my relative level of concern over the adverse events that were cited. So if I was concerned about incontinence, I would indicate it as such. And then the very last screen gives me a personalized checklist that I can print out and take with me to my next appointment. They're optimized for smartphone or mobile use, and then everything through the Effective Healthcare Program is available through the Effective Healthcare website. Again, all of the materials you see here are federally funded and available to anybody in the public at any point in time. What we are trying to do is to promote a healthy shared decision-making process. We know that the amount of information that patients have available to them has exploded, and so there's a lot more available to draw from, but we're still not at an ideal place where patients and clinicians are holding fully interactive discussion about treatment options. And so this program is designed to help facilitate that. And we've done some other research and know that patients are interested in receiving a specific recommendation from their healthcare team, but they want to come to the appointment prepared with some information. While they're not doing it as much as we'd like, we know that that's where their desire is. So what we're trying to do is put those tools in a place that they can use that and be able to discuss their options with their healthcare team. So earlier I mentioned that we have summaries available for clinicians and consumers, and I'd like to go into a little bit more depth for each of these publication types. First, with the clinician summary, again, we're distilling 1,000 pages of research into a document that is, on average, 6 to 8 pages in length. Some are much shorter. There are a few that are a little bit longer. But in general, they're meant to be something that can be read very, very quickly. They all contain an overview of the condition, the clinical issue at hand, some of the key conclusions that came about as a result of the study. But we also have, and it's usually on the cover of these clinician summaries, a clinical bottom line section. And this clinical bottom line is a quick, at-a-glance way to get an understanding of the findings based on the confidence in the studies that were cited. So that we have 0 to 3 confidence level ranking, and so if you've got 3 green dots, it means we really don't anticipate any significant changes in the findings. There are enough studies that have been done that we don't anticipate a change. So it's a way to digest a lot of information in a very, very quick fashion in order to help to facilitate that shared decision-making process. We also do cover both the benefits, the adverse events, where there are gaps in the knowledge. Other information on the back of these materials are here's some points to discuss with your patients. Here's an example of some of the resources that we have that are available for patients that mirrors the information that's found here. Ordering information, and then the sources. So, this particular summary I know was put together by Johns Hopkins. So there's information about how many studies they reviewed, the review process, etc. So this clinician summary is it's distilling that 1,000-page research report into a document that is suitable for somebody with advanced degrees that is in a clinical setting. As a complement to the clinician summaries, most of those clinician summaries have an accompanying consumer piece that are written at about a 6th to 7th grade literacy level. They contain the exact same information as what is found in that clinician summary. It's just literacy level is the only true difference. The summaries are available in multiple formats. They are available as a PDF file. You can actually get them in HTML through the Effective Healthcare website. They're also available as audio podcasts. So for those with visual impairments, they can have somebody, it's almost like an audiobook, somebody reading the summary to them. And almost all of the consumer summaries are available in both English and Spanish as well. So the consumer summaries, again, they contain an overview of the condition, they contain the key findings, they contain all the various treatment options, benefits, risks, gaps in the knowledge, but it's presented and written in a way that's more appropriate for a patient. And so use of a lot more white space, different colors, charts, graphs, photographs, and then an area for important questions. Here's some things to ask your healthcare team. Here are places to write notes. But these consumer summaries are designed to be a complement to the clinician summary materials. All of this information can be found at effectivehealthcare.arc.gov. This is the true kind of almost comprehensive clearinghouse of information. This is where you can submit questions, where you can see questions that are being addressed or in progress, draft versions of reports that you can comment on. You can also find all of the various tools. So those continuing education modules or CME modules are housed here. Faculty slides are found here. You can look at if I had time at the conclusion of the meeting, I might be able to show you a couple of examples if we navigate over to the website. But there are the summaries that are organized on this site by condition, in alphabetical order by condition, and a real quick way to see the materials and to either download a PDF or order the materials. In addition, and it's not really called out on this slide, another element of this website that I find extremely valuable is the search function. You can search this, do a keyword search within effectivehealthcare.arc.gov and uncover a treasure trove of information. You can very quickly, if you're interested in information about opiate addiction, well, we don't have something published on that, but we have maybe a draft report that's on the way, or maybe it's that is an issue that's being addressed in some of the faculty slides. The search function, I cannot overemphasize it enough. It's a wonderful tool to be able to go through volumes of information and really get directly to what you're looking for. So that is the effectivehealthcare.arc.gov, and that is where you can access any and all material. In the last few months, we have launched a new initiative that is actually a couple of initiatives that are running in parallel with one another, one for healthcare professionals and the other for consumers. And this initiative is designed to promote all the free resources that are out there and available to help patients and clinicians use evidence-based health resources to make informed choices. It invites national, regional partners. We are working with organizations that span the spectrum to share this information with their patients, their members, their stakeholders, and give them access to all of these reliable tools and these objective tools that help to provide that informed decision-making process. For the consumers, we again, I mentioned the studies that we did indicating that consumers do want to come to an appointment with a good bit of information, kind of prepare for their appointment. And so this program is labeled Explore, Compare, Prepare. It's a way to help patients understand that there is a lot out there that they have to sort through, and there is a single resource, the Effective Healthcare Program, that can help guide them through the various options that they have available to them. The webpage, and I'll show you a screenshot of that webpage in a minute, but arc.gov/treatment options is where you can find promotional videos. So we have a video for those who have been newly diagnosed with a condition, videos for those who have been living with a condition for some time, maybe receiving treatment, but want to see if there's anything out there that's better or might be better for them. And also we have a video for a caregiver who is helping a loved one through a diagnosis. We have a text messaging program. We have patient brochures. We have posters. We have a Facebook page for both English and Spanish speakers. We have a number of different online tools and digital tools to share. And we've also established a relationship with WebMD for some of our key priority conditions, such as diabetes and cancer or mental health. to where anybody doing a search for that on WebMD will be directed to this program. So we have a robust national campaign focused on providing this information and helping patients understand that you really can benefit from the facts. Whether you've been newly diagnosed, you're dealing with something that you've been dealing with for some time, or you're helping a loved one through a difficult situation, facts will really help you prepare for the way to make a decision that's right for you and for your family. In parallel with that is the Clinical Bottom Line program, which is targeted to healthcare professionals. Likewise, we have a webpage for health professionals where they can access the treatment summaries, look at not just the clinician summaries, but gain access to the patient summaries as well, access the brochures and materials to use in their treatment rooms or their waiting rooms. A lot of different ways to get involved in the kinds of outreach that we're doing and help provide some of these tools to their patients and to their clinical staffs. This also, we have a complementary piece working with this clinician program through Medscape as well. So like the WebMD piece, when there is a search that's conducted, it drives healthcare professionals to this Clinical Bottom Line program and campaign. So here's a snapshot of the Clinical Bottom Line webpage for healthcare professionals. So we have a lot of outreach that's happening, and we really believe that for those of you working in telehealth, there's a great deal of relevance. I mean, this comparative effectiveness research really does touch on all walks of life across the spectrum of healthcare and helps clinical teams and patients understand the latest information about the best practices, the best outcomes, and again, work from a place of information in order to make the choice that's right for that particular patient with that particular diagnosis. A number of organizations have joined forces with us to help share this program. The American Nurses Association uses a material from the Effective Healthcare Program in a toolkit for members. Maryland Department of Health and Mental Hygiene use materials to help understand and help educate about the appropriate use of antipsychotic medicines in children. Even businesses, IBM Integrated Health Services. We have in fact a relationship with the National Business Group on Health, who've used the Effective Healthcare Program tools to provide recommendations to their teams, to their benefits managers, to their employees in order to find the best options that are available for them. So we have a number of different examples, again, across the spectrum of healthcare where the Effective Healthcare Program has really been adopted and embraced wholeheartedly. And part of that is the effort of developing a national partnership network. I am one of 5 regional office leads who go out and work on a state and regional level, but we have colleagues who work on national relationships. The American Nurses Association on the previous slide is an example of that national relationship building and the work that as Bob mentioned at the beginning, the predecessor in this particular region, her name was Kate Stabara. She's working in a specific geography, and her replacement will be working in a specific geography, working to find people who want to simply raise their hand and say, I'm interested in helping my stakeholders become aware of this program. The partnership network doesn't require any cost or any obligation. It simply requires saying, I want to help. Because we cannot get out and speak to all 300 million Americans. We need help from people like you. And there are a lot of benefits to becoming a partner, one of which is if you're interested in printed materials, you can get a bulk order of up to 500 printed pieces shipped to you at no cost. The general public can order 25 copies of brochures, printed copies of brochures, but beyond that, they're paying for a publication fee and shipping. Partners don't pay for either up to the quantity of 500. In addition to the availability of of printed materials, we also have other tools that we can make available, things like a pre-written, pre-approved newsletter articles, whether it's for an e-newsletter or a traditional newsletter. We have web buttons. We arrange for speakers for webinars. We could get and have had success getting a researcher to present a webinar on one of the studies. We have a whole host of tools that are out there and available to help facilitate use of these materials, and that's what we work on, and that's why we look to organizations across the country to become partners. I kind of covered this. I'm based here in the regional office level. We've got national partners, our national initiative that works on national relationships. And there was a group, and they're actually wrapping up their contract, but there was a group that was going out and doing academic detailing at the practice level. Primary care practices were usually where they were doing these details, but so we have a dissemination framework that is designed to surround the public with this information and ensure that these resources are available at the point when they are needed. I mentioned there are 5 regional offices. NRTRC is served out of our Denver office, and they're close to announcing a new person, but all of these offices are aligned with Health and Human Services regions. So I'm based in the Dallas-Fort Worth area, and so I cover a geography from Louisiana and Arkansas out west to Hawaii and the Pacific Island territories. This Denver office kind of covers the Rocky Mountain states in the Pacific Northwest. So we have people across the country that are doing just what I'm doing, explaining the program, making people aware of it, and finding where there may be ways to, for certain organizations to get more involved and tap into the resources more robustly. Apologize, this slide is not showing up well, but you imagine, if you will, the map of the United States. There's numbers for all the different states, but I think the important piece here is that we have 478 partners across the country for this regional office partnership network. You add another 100 or so in for the national program, and we've got more than 600 organizations that are signed on and enthusiastically sharing this information. And so it's a program that's been so incredibly well received, and something that we are so thankful for organizations who go out and share this information. So again, some of the benefits of partnership are to share this information with stakeholders, use the slides, order summaries, or download the PDFs of the summaries to use in your conversations. And in a telehealth setting, providing that PDF is something very simple to share with a patient to provide a little bit more information about their particular condition. If you're interested in seeing some research that has not been conducted yet, it starts with you. It starts with the public. Contribute a question to the research process. And if you're so inclined, we'd love to talk with you more about how to become a partner in this initiative. Again, there's no cost, there's no obligation to partnership. It's simply saying, I want to help. I have an audience that we could share this information with, and we'd like to figure out the best way to do that. To access the resources, again, I'll leave this slide up just for a little bit, but the website is here, effectivehealthcare.arc.gov. You can also order free copies of the summaries through a toll-free number. The AHRQ Publications Clearinghouse is based out of Silver Spring, Maryland. There's that toll-free 1-800-358-9295, where you can email the request if you know the title name and how many you'd like to order. You can get a special kind of white glove treatment with referencing order code CO2, but either way, please do explore this program, explore the options that are out there. It does us no good for these materials to sit on a warehouse shelf or to live on our website. We need it out in the communities so that people can make the choice that is right for them based on their information, based on their diagnosis, and their consultation with their healthcare provider. So with that, I have reached the end of the slides, but I'm happy to address any questions that you may have through the chat function, the Q&A function, or Bob, I don't know if anybody has sent any direct chats to you or not, but I am more than happy to answer the questions that you may have at this time.
Well, I've got one for you, Jake. That's kind of, it's very self-serving, but has
Mhm.
any of the research been done on delivery methodology? Specifically, has anyone compared the efficacy of telemedicine to in-person care provision?
That's an excellent question, Bob, and I honestly do not know the answer to that right off the top of my head. That's something that through that effectivehealthcare.arc.gov, my first step would be to go to the search function and just look at delivery methods and telehealth as some search terms, and I would imagine, well, if it's had any kind of discussion, it will come up immediately. I'm not aware of anything right off the top of my head, but there is a significant component of this program and a significant area of interest for us in rural health, and so I think rural and telehealth play so well hand in hand that there is bound to be some information that's out there. I can't cite it off the top of my head.
Yeah, that's great. I don't see any other questions coming up, so I guess we'll wrap it up. Jake, I really appreciate you taking the time. This is an exciting question, an exciting concept for me, and I'm certainly going to pursue it further just personally. Uh, and NRTRC will look into partnering too, I believe, because I think we can really help our constituents. You'll notice that Martha has just put up a web page that has a survey. Please take that survey and tell us what you thought of today's presentation, and equally important, what presentations you'd like to see in the future. So if there are no further comments, Jake, I want to thank you very much for your time and for providing this interesting uh, presentation, and we'll certainly be continuing to work with AHRQ, I believe.
Great. Thank you so much, Bob. It was my pleasure, and you all have a great day.
You too. Thank you.
Bye-bye.